Okay, so for our first exercise, when you're rehabilitating from an ankle sprain, is to try to strengthen certain muscles. If you have a lateral ankle sprain where you're getting damage on the lateral side of the foot, what will happen is that you'll also, not just the ligaments will be damaged, but also the muscles on the side of the leg called fibularis longus and brevis. And these muscles, when they fire and they contract, what they should do is stop the ankle from rolling laterally on the outside. So we're going to do some strengthening exercises to try to strengthen those muscles. Okay, so for the first thing we're going to do, so you can see the assessment on this, is I'm going to get Rob to turn around. And what I'm going to get him to do is I want him to lift up his heels off the ground, and I'm going to show him, or I'll show you a way that exaggerates the problem if the fibularis longus and brevis are not firing. So Rob, if you can just lift your heels up. And what you'll see here is this curvature occurring, and it's because the muscles on these sides are not firing correctly to keep the ankle straight. So, okay, you can relax. So the first exercise that we'll do is, I'll get you to turn around, Rob, and you have that quarter for us? So all you need is a quarter. Place it under his metatarsal joint, which is the joint just articulating for the big toe and the foot. So right on that ball, I'm just going to place it right there. And now what I want him to do is he's going to lift that leg behind him, and he's going to just use this leg, and he can support himself against the wall, that's no problem. And what I want him to do is focus on when he lifts his ankle off the foot, or off the floor, to put all the pressure through this point. Okay, go ahead. And relax. Okay, and we'll show you from a posterior point of view. So here we'll use the other foot for this one. So you can turn around. So again, placing the quarter under the foot, right at that metatarsal joint. So this foot goes back, you can lift it up a little bit higher. Okay, and lift the foot up. Noticing that it's much straighter now. Okay, and relax. So I would get them to do this one maybe 3 or 4 times, depending on if there's any pain. If there's any pain associated with this, I would recommend not to do that until the pain subsides. So for the next exercise, this is more of an advanced movement, but what I'm going to do is put a little bit of a challenge, so to create more strengthening for this fibularis longus muscle. So what I'm going to get Rob to do is, you can stand up ahead a little bit more for me, Rob. We're going to place that quarter. He's going to do the same exercise as he did before, but I'm going to challenge it now by putting TheraBand around this side so that when I'm pushing along here, it's going to create more contraction occurring along here, along the fibularis longus and brevis, to prevent that, that outward turn of the lateral side of the ankle. Okay, so we'll get you to do that. And down. And try it again. Great. Okay, and we'll just show from the posterior side. Okay, so we're going to do the same exercise. I'm just going to show you from the posterior view so that you can see how straight the ankle, the alignment is. So we take the TheraBand, and then we'll get him to lift, creating a little bit of a outward movement, firing off those fibularis longus muscles again, and brevises.